A very good afternoon, ma'am. It must be good evening there, but as
Yes,
per India time, a very good afternoon, ma'am. Thank you so much for giving us your time and coming here. So, I would ask my first question to you is: could you please tell us about yourself?
sure. Thank you so much for having me on IC Tale. It's an absolute pleasure to be here. I think, as you all know, my name is Dr. Nivi Manokaran, and I'm a dermatologist and a venereologist from India. And I work as a sexual and reproductive health clinician here in Sydney, and I've been doing that for about 11 years now. So that's pretty much my background of what I do. Coming to, people always ask me as to how, from being a dermatologist, you've gone into working in sexual and reproductive health. So I always tell a little story about it. And I tell people that, when I first came to Sydney, I really couldn't find a job in dermatology or, a training position in dermatology. And what I first did is, I applied for a job in sexual health because in India, there is a combined degree between dermatology and venereology, and venereology means sexual health medicine. And yeah, so that happened, and I started to take that, and I thought, okay, next time, or next year, I will apply for something in dermatology and pursue that way. And it's 11 years now, and I've still continued doing my career or my job in sexual and reproductive health because I'm absolutely fascinated by, the importance that sexual and reproductive health as a medicine gets here. And I think that is very, very important. I've missed it as a youngster in India, and I also have missed it learning a lot of things, the right attitude, right questions, the things that we can do for youngsters who are sexually active, acceptance, non-judgmental attitude, a lot of things. So I feel like it's been a big learning curve for me, also because I've missed out on it as a youngster, and I could really relate to how important or how much we can help people if we actually pursue this in India. So that's why I continued doing sexual and reproductive health, and I absolutely love the job. And at some point, I think thanks to COVID, when everything became online and there was so much more happening on social media, teaching was happening on social media, reaching out more people was happening on social media. And I think that kind of gave me an idea that it doesn't matter where I am or which part of the world I am, I can still always, teach or, reach out to India or give back to the country that I grew up in. And I think in a small way, I hope I'm making some difference. And I think that is how I feel by the work that I'm doing now. And yeah, so that's where I am at. And that's what my page, Dr. Nivi Untaboo, does, is a talks about a lot of things that are tabooed that are happening and people are not okay to talk about it. So I would like to actually address those things, talk about those things, and make people understand that, if you actually talk about things that are happening rather than not, it is probably so much easy to prevent complications that happen because of that. So yeah, so that's the thing behind Untaboos. And yeah, that's pretty much me.
Actually, talking about taboos and sexual related things, it's still a taboo here, like in India, if I talk about, and it's a really great step to spread awareness. So that this taboo of talking about things can become untaboo. Because me as a person still feels shy when it comes to talking about things, which is like talking about things to my parents. I will feel shy here. And
True.
when coming to my friends, it's like, okay, everything is normal.
Yeah, true, true. And I think we also feel like we are being judged, isn't it? Because there's a big
Yes.
judgment factor. And I think still people associate, anybody talking about tabooed things as something is wrong with their character or something is
Yeah.
wrong with their morale. And I think that is the problem because we don't want to appear as somebody with, poor character or poor morale. And I think that is why we are actually being very careful and then we don't talk about it. We don't address things that are important. So yeah, it's a shame, and I think we slowly have to change it and understand that talking about things that are taboo does not necessarily make an individual bad or make someone with a bad character, and it shouldn't really be connected to the two. Like, do you know what I mean?
Yes. Yeah, absolutely.
Hmm.
So, as a sexual health physician, you are using social media tool to spread awareness about married issues. So, how do you go about curating educational content on sexual awareness and wellness?
How do I create content? Is that the question?
Yeah, how do you go about curating educational content upon sexual wellness and education?
Right. See, I what I do is I basically try to do my content based on what questions I get asked on a day-to-day basis. And that is how I do my content. Because I think it is a big advantage that I also work as a sexual and reproductive health clinician, which means I do this for a living and I also do it on Instagram. So this is all I do all day long, which is kind of really good for me in making my content because on a day-to-day basis, when I see a lot of youngsters, when I get a lot of questions, and when I see them coming up with myth or things or beliefs that they have which aren't true, those are the things that actually gives me ideas to put my content, and I kind of answer those questions and those queries in the content, trying to educate people. And I think that is the best way to do because my questions and my content come directly from the people that I see every day.
Actually, a very great way to, have a connect over social media
Absolutely.
audience and the physical people you are meeting
Real,
there.
yeah, the real audience. Yes, yes. And I think that helps me that I work in the same field. Um, as sexual and reproductive health clinician, I see youngsters on a day-to-day basis. So I think it kind of helps me do my content in a more realistic way, more realistic
Yeah.
questions that people come up with.
Absolutely. So, in today's market driven world where empathy, compassion, and kindness are very hard to find, so how do you bridge and overcome the issue with those who are vulnerable and compromise simply because of the gender inequality?
Look, I think to do this kind of job, you first need to be a very compassionate and a very empathetic person, and a very non-judgmental person. I mean, sometimes I think people think that, oh, what is with sexual and reproductive health? It's not like anything big anybody can. But in all honesty, doing sexual and reproductive health is actually very, very demanding, especially when it comes to the emotional side of things. Like when you're talking about people, coming out, gender inequality, LGBTQ community, you're dealing with a lot of people who unfortunately are still, minority or still, are tabooed in many places and are finding it very difficult to actually come out. And so when you're dealing with things like that, I think you need extreme empathy, extreme kindness, and you have to be compassionate. You have to have an understanding about their mental health. You have to have an understanding about their mental state, their emotional state, a lot of things. So I think it takes a lot to be able to be that
Yeah.
non-judgmental sexual health clinician. And I think it is a skill that is probably inborn in a certain way, but I think it is also a skill that is trained.
Actually, because LGBTQ here in India, LGBTQ is the major issue. That if someone belongs to that community, people don't like talking to the person. He or she feels like, okay, they must have a disease that they're going through, and it's like untouchable. We cannot touch the person, or either we'll get affected, or like it's not something we are here, not me exactly, but the people here are ashamed of calling that one person as your friend. That is what affecting me, in personally that was affect me. So I really want that thing to be changed, like in the perspective of sexual health and gender inequality.
I think so, and it's a sad state of affair, and I think a lot of the people's understanding about LGBTQ is very little. Many people actually think that it is something that is made out of choice. People think it's a choice that people are
Yeah.
making. Sometimes they feel it's because of some kind of bad company or somebody has influenced someone to make the choice. A lot of the time, people are in denial. They don't want to accept that It is not a choice. It's how a person is born. It's how they are. It's not a choice that they are doing. Some in India, I've heard it many times. People say, get them married, get them settled. They will become okay, or they will change. It's almost like they're not okay, or it's almost like you are trying to change them because you think something is wrong with them. And I think that understanding is what is important. I think that is very basic knowledge of LGBTQ. People thinking that the whole, being lesbian or gay or bisexual is actually a choice is
Yeah,
wrong. People should understand that it is not a choice that people make. It's not
absolutely.
that somebody just wakes up and say that, "Oh, okay, today I want to be, today I want to be a lesbian." Or it's
Yeah,
not like saying, "Oh, tomorrow I don't want to be." It's not a choice. We have to understand that your sexuality is not a choice. You're born with it. And people are actually finding it extremely difficult to come out, especially in a majority of the world where majority is heterosexual. Unfortunately, still majority of the people are heterosexual, men
yeah,
and women, cis, gender. And I think in that kind of a community, it is so difficult for the minority to actually come out, because this large, vast community is failing to understand how that works. And I
exactly.
think that is so difficult. It is awful, actually. I feel terrible. And I actually take a lot of time trying to explain to people that it's not a choice. Somebody hasn't made a choice to be, gay. That's how they are. And we have to accept it and support them, because that's how we are. We have to love them as they are. And it is not something that is changeable. So I think that is very basic understanding. And I think that is something that's very basic education,
Yeah,
very basic sex education. You know what I mean?
yeah.
And I think we lack that. So that is something that is very important to make people understand. Very
Some,
basic things. When we talk about sex education, I think we always talk about, either we're talking about reproduction, as or we're talking about procreation or having babies. We're talking about the male reproductive system. We're talking about the female. This is how we've been taught anything to do with
yeah,
sex organs, or it's all about reproduction, it's all about procreation. We've never been taught about pleasure, we've never been taught about recreation, and we have never been taught about all these things. Sexual orientation is very basic. Sexual orientation is basic. People have to know this, in order to be sensitive, in order to be empathetic and kind.
even there are times when people, there's mass media like movies has a great impact on creating this lack of awareness. I remember one of the movies is uh, Mismatched, a series on Netflix. There was
Yeah, I think yeah, I saw that.
the
Yeah.
season one, this girl, I don't remember the name, but she was playing a role of a lesbian. She was afraid to come out, but accidentally she came out by a friend, and the the people around her started to judging her. And there are quite a few movies before this mismatch series. People, this mass media has created such an impact that people judge people who belongs to this community. They think this is an abusive language, this is an abuse or a shame to the society. But slowly, this mass media is also creating an impact that, okay, LGBTQ is also, people are humans. They also have the same feelings, but in a different manner, but for different people, like male going for male, or female going for
Yeah.
male.
Yeah.
They have the same emotions, but of the same gender, they are very attracted to. Like Badhai Do
Yes.
movie
See,
is
but I
all,
think people have to understand that is not a choice.
yes,
Because I think that is what is important, because a lot of the time people think he could have had sex with a girl, or he could have had a relationship with a girl, but he made a choice to have a relationship with a man. That's not true. You have to understand that being gay or
exactly,
being lesbian is not a choice. That is the
exactly,
way people are. And I think that is what is important, is to understand that it's not a choice. Because when you think it's a choice, you want to go and change the choice, you want to change their mind. You feel like, let me say something, let me do something, let me get them married and change. No, you have to understand that it's not a choice that they're making. That is exactly how they are.
exactly,
It doesn't
exactly.
matter whether you, I don't know, it doesn't matter whether you don't accept, It doesn't matter if you're going to get them married forcefully. It doesn't matter if they are actually, having sex for procreation and having children.
Yeah.
But if they are gay by nature, they are lesbians by gay nature, they are. It's not the choice, and it's not something that you can change.
Exactly.
Mm.
So, how are you able to normalize the discussion about sexual health and reproductive health?
Yeah, I think I have learned that skill over years, I should say. Initially, I think when I was in India, and as a young person in India, I think you are very, very worried about the fact as to how the society is going to look at you, how the society is going to judge you, and I think that is the most important thing we are taught in our lives, I think, in India, right? Constantly you're thinking about what will they say, what will he say, and your behavior and your thoughts and what you're saying, your words, everything, what you believe, what you're not, your sexuality, you coming out, everything is based on the fact that what will someone else think about us. Okay. And I think that is what is important. And then, at a point, after log kya kahenge, I think we come to a point ki shaadi kaun karega. We come to a point, tum aise baat karegi to shaadi kaun karega. So, you then fear as to, oh my God, I should be of a certain standards. I should say
Yeah.
only certain things. I should behave in a certain way. Tabhi shaadi hoga. So those kind of fears, it's always about someone else. And I think as I have grown, I think I have evolved in my life where I have crossed that point where I don't care about log kya karenge. So I think that is your breaking point. When people don't care ki log kya kahenge na, I think that is when you start talking without inhibitions.
Yeah.
That is how that is exactly how you start talking about things that are tabooed and say it is okay. Because till that point, I think you are worried about wo kya kahenge, ye kya kahenge, and all that, and kya hoga, shaadi kaisa hogi, ye sab. I think I have reached a point in my life which is very good that ab to shaadi ka fikr hi nahi hai, shaadi ho gaya, bacche ho gaye, so I don't, it doesn't matter. And I think I have reached a point where honestly I don't care. Log jo bhi kahenge. People who know me or people who are friends with me are always friends with me. And I'm not very young. So I've had friends with me for years.
Yeah.
Jinke saath mein aise hi hu. So I think that is the thing. When you stop thinking log kya kahenge, when actually you don't care, then you will see how you lose your inhibitions and you start telling exactly what you want to tell or exactly how you want to feel because you don't have that fear. The
Exactly.
fear of log kya kahenge and the fear of shaadi kaun karega is most of the time the things that actually don't let you be yourself.
Exactly. वो लोग क्या कहेंगे, लोगों का तो काम है कहना.
True.
If we had lose, if we starts this work job of theirs, then what will they do in their free time?
Hmm.
So this
Hmm.
is the same philosophy even I follow most of the times now.
Fantastic. And I think that's a very good philosophy. And I think everybody should follow that philosophy because once that is gone now, once that inhibition is there, because constantly worrying about log,
Yes.
it's just exhausting actually. So when you stop worrying about log and when you can just be yourself, and I think that is very, very important.
Exactly.
Uh, hmm.
So, what led to your decision of working in this field of healthcare, which is often marked by a stigma or a taboo?
Yeah, I think me missing that care when I grew up as a youngster in India is something that has actually made me stick on to this because I feel like when I was young and growing up in India and when if there were people who questioned about sexual assault or if there were people who questioned about safety, if there were doctors or people who questioned about contraception and are you safe, instead of the minute you say you're having sex or you're sexually active, instead of people being rolling your eyes and giving you this judgment looks and saying, oh, who knows ki kya karegi in this young age, she's having sex already, and those kind of attitude, those kind of thing, I think kind of put me off. And then when I came here and actually thought that there's really a field of medicine where I literally find youngsters, between the age of 14 and 21, and tell them how to have safe sex, how to not fall pregnant, and how to come for regular STI checks, and how to make sure that their sex is consensual and not forced. So when I'm actually doing that as a job, I'm just fascinated because I missed out on that. That's exactly what every young person needs in a country, is that kind of a support system where there is someone who's actually got your back and talking to you about your sexual life in a non-judgmental manner.
That's one.
And I think that is yes, and I think that is important.
Yeah.
And that part that I play, doing that for people that I have missed when I was a youngster, is something that I absolutely, enjoy and take pleasure. Yeah, so I just feel like I'm going to stick on doing that for a while, and I'm going to try and come and pass it on to India and people there, and try to do my sex education there, and yeah, provide the care I do here there as well. And yeah.
Waiting for you soon, waiting for you soon.
Thank you.
So, how is a day in the life of a doctor? Like, could you please elaborate upon that?
Yeah, absolutely. See, the best thing I like about this job and also about Sydney is I think there is an amazing work-life balance. And I think that is very, very important. And I am a total believer of, work-life balance. I do not uh, push myself for the sake of money and finances. And I think that is very important because, your children and your kids are young only for a very short time. And for me, I think it's a very crucial period of time. So, so I actually have very, flexible, shorter days. And because I like to drop my kids off in the morning hugs and kissing them goodbye in the school, and trying to go and pick them up a couple of afternoons from, school, having a chat to their teacher, then getting them some ice cream or something on the way back, and spending that evening time. Those kind of things are actually very, very important to me. And I try to cut my days shorter and try to do that work life balance, because I know that at a certain point in time they'll be all grown, they'll be gone. You can work all the time and they may not need you as much. So for me, I think as a doctor, I am very fortunate that I do a job where I am able to have flexible hours, and my work life balance, and me as a single parent trying to manage, to raise two boys who are absolutely gorgeous, and teaching them, the right values, showing them a lot of love, and, making them feel secure. So it's a lot on my plate, and I think I try and balance them pretty well.
Perfect. So, how have your thoughts about the medical profession and being a doctor changed after completing your residency and the beginning practice?
I think I think it has been a big shift for me because I have moved countries in that time, being a resident and being, a younger junior doctor. I have moved countries, after which I have started working in a different country. So, and I should say that the work culture back in India and the work culture back in Sydney is completely different. It's definitely, it's not the same. And yes, it's hard work everywhere. It's long hours when you're doing hospital, rotations and shifts and things like that. Yes, but I feel like there is more equality. There is more, you can verbalize how you feel. You can, it doesn't matter your hierarchy system. It doesn't matter. You can still verbalize. You still have an opinion. You still, people respect you for the person you are. Even if you're a junior doctor, they ask your opinions and, do things accordingly. So it's been a very pleasant journey getting, retrained and redoing stuff here in Australia. And I feel like I've learned so much as an individual, as a person here. But to be honest, life, like, it's different. It's completely different kind of atmosphere. Your entire training programs and how you're doing it and how people treat you, everything is so different to back home. So yeah, so it's been a different journey, but I have enjoyed it.
Actually, so there are no full-fledged treatment available for HIV, but like you said, it could be undetectable. The
That's
HIV,
correct. So okay, so
yeah.
that's
Sorry.
correct. So I think we're jumping into HIV now. Uh, yes, HIV is a huge research area that has been, people have been working on it for a long time, and it's an area where things have changed over the years. And yes, HIV is non-treatable. You can't treat it, it's not gone completely,
Yes.
but it is now looked upon like a chronic disease. Like, you have diabetes, you have hypertension, something you will have for the rest of your life, but can be kept under control. So HIV is looked as one of those things where you can keep your virus under control, where you can stop the transmission of the virus from yourself to another person, even if you have unprotected sex. If you're under treatment and if you're undetectable and if your virus is undetectable. So yeah, so like that, there are a lot of advances, and you can use HIV treatment as prevention. So before getting HIV, you can take the tablets. It's called PrEP, pre-exposure prophylaxis, and there is also what is called PEP, which is post-exposure prophylaxis, where just in case a risky exposure has happened, you can take those medications for a certain number of days in order to prevent yourself from getting HIV. So like that, a lot of advances has happened in HIV, and I think which will be unfair if I try to fit it into this interview about myself. So yeah, so HIV care or HIV management is a big topic on its own.
So for that, there must be there's a therapy called the art therapy, if I'm not wrong.
Yes, there are many, many medications available for HIV these days. Most of the time, it's a single tablet.
So my next question was, I was asking any interesting stories to that adds to your diary. If yes, could you please share? We would love to hear some of your stories.
When you mean interesting stories in terms of like patients or
Your work life till now.
work life, yeah. Yeah. Well,
So
I think everything is interesting. I think to begin with itself is, this whole profession that I've taken is very interesting because, like I told you, I grew up in India. When I got, my qualification in venereology, I just, I was very thorough with my book. I knew how to identify all the STIs, and I was really very good at it. And I came here and I joined this, sexual health department. And I thought, oh, I know it. I can diagnose things. And then my boss actually came to me and then he said, okay, Nivi, come on, let's just take a sexual history. And I thought, sexual history. I said, okay, because when you're seeing a 17, 18-year-old girl in India, I think, first of all, I don't think I can ask her if you're having sex. She might get offended by the fact that I'm even asking her that question. So I really didn't know where to start. I was thinking, oh, I said, okay, because it's a Western country, I thought maybe I can ask her that question, right? So I said, have you had sex? And she said, yes. And I said, okay. And then I looked at my boss and I said, yeah, I've asked her the question. She's had sex. And then he hands out to me like 4 pages of detailed sexual history. And when I started asking her those questions and in the depth of those questions, that is when I really understood how much is there in a person's sexual life and why sexual health has to be entire department or entire subject on its own, because there is so much to ask. So when you ask someone, are you having sex or are you married, do you want to have babies, those are not the only things that actually comprises of sexual health. It's very important we start very early. Things like, what do you identify as? Do you call, are you male, female, cis male, female, those kind of things. Sexuality, do you have sex with men, women, or both? And things like, have you ever been forced to have any sex? So we rule out sexual assault. And we ask about, are you scared, or is anybody, are you fearful of someone at home? Like, we're trying to rule out domestic violence. And then we ask about, do you ever have sex, get paid for having sex? So we're trying to see if somebody is doing sex work, do they need more testing, more screening, so all these questions have to be actually asked to someone without a flinch on your face. And that is a skill, and that is an art. I think that I have learned over the years. So that was shocking for me when they gave me 4 pages and say, here you go, these are the questions that you need to ask, because I didn't know how much is involved in, sexual health. And it was absolutely amazing for me to be able to learn that. And today, I go through those pages without seeing them, without a flinch on my face. I just, when I go through it with so much passion for the job. And I think that is something that I've really cherished and enjoyed. And yeah.
So, just asking out of curiosity, is there any device that can actually detect whether the person had sex or not?
No.
No. So how can you being a doctor, how can you identify that the person had been physically intimated or not? Like he,
Why should I?
no, I'm just asking out of curiosity.
No, why should I? I'm also asking why. I'm asking the patient if you've had sex or not. And if the patient wants to tell me whether they have had sex or not because I have gained their confidence, that is it.
Huh?
That's it. It's the same when you're married. It's the same when, when people think that, I will find out whether he's a virgin or not. I'll find out whether she's a virgin or not. But the truth is you can't. You
Exactly.
can try all you want. You really can't. It's honestly, if the he or she decides to actually tell you, or actually, confess with you that, I've had relationships in the past, or if there are people who want to talk about their relationship, yes. But otherwise, there is no magical way to say, I'll find out if they've had sex. No, no, you can't. You can't find out. The best way to do it is called trust.
Actually, I got my answer because there's just so much of misconception through media about the same question.
Yeah.
So I was actually looking for the answer for since a very long time. So I got my
No, no,
answer.
you can't. Like, actually, to be honest, the virginity market is a big industry. you
Yeah.
know there are plastic surgeons who do hymenoplasty. That's what we're talking about, reconstruct people's hymen. There are people selling fake bloods. There are fake blood. There are 1 billion things available in the market. So whether you actually want to find out if somebody is a virgin or not is something that they have to disclose to you. And the only way you can probably get that done is through trust in that relationship, because otherwise I don't think anybody is going to nail that.
Thank you for answering my out of box question. So, what is the best thing about your practice, or any closing remarks?
um, the best thing about my practice is I think we need more non-judgmental doctors
Yeah.
who are available and who are there to help youngsters rather than to judge them. And I think that is what is very important part of sexual health. I mean, it doesn't matter if you're doing sexual health medicine as a specialty on its own, or it doesn't matter if you're a general practitioner. It doesn't matter if you're gynecologist or an infectious disease specialist. It doesn't matter what it is, but I think as doctors, we need to have a non-judgmental attitude and an attitude to help youngsters to come out to us, whether it's about their sexuality, whether it is about abuse, assaults, symptoms, fears, contraception, whatever it is. We should help youngsters to actually come out with those concerns and help them have a healthy and a safe sexual life. Instead of being in a frame where we keep repeating the fact, saying that they are not supposed to have sex or they shouldn't be having sex and things like that. I think it's high time for us to accept, as doctors, especially as clinicians and individuals, that youngsters are having sex. People hit puberty around 12, 13. These days people are getting married when they are 32. I mean, if you're expecting from 13 to 32 that nobody is actually having sex, it's kind of, we are in a country where the population is about 1 billion. So I think that's a blunder. So I think it's time to change the dynamics. It's time to start being accepting and actually help the youngsters have a much healthy and a safe sexual relationship and make informed choices, consensual sex, those kind of things. And I think that's important.
Thank you so much, ma'am, for giving us your time. I am done with
No
my
worries.
questions.
Perfect.
So I'll just
That's
stop.
good. Thank you so much for having me. And if you guys have anything you want to learn or anything you want to question, yes, you can DM me. And there is so much information on my page, Dr. Nivi and Taboos, where you can follow me on. And yeah, and I'll see you.
We are really waiting for you to come here and make people aware about the sexual education and sexual wellness, what exactly it
Sure.
is.
Thank you.